Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. Let's talk about generalized external pediatric root resorption in permanent teeth. I'm not talking about baby teeth. It's a kid, maybe they're 10, maybe they're 12, maybe they're 14. They've never had ortho, and every single tooth has root resorption. And I'm not talking about just a short root, that's the way they were born. Like the roots got shorter. You know, I'm assuming most of you are taking at least bite wings and PAs in your little kiddos. And then at least you're taking a pano in a 7-year-old. This is standard of care. I'm talking about 7 looks pretty normal, 12 to 14 looks short. Never had ortho, didn't have trauma. It's one thing if like 8 and 9 are the upper ones, maybe they got hit in the face, right? Premolars, anterior teeth. I've seen a few of these in my lifetime where we take the x-ray and we're like, oh shit, excuse me. But that's basically what we say, like, how did this happen? Oh no, this kid's gonna need dentures, a full all-on-4 at 20. Like, I've seen a few cases like that, and it is the worst. It is like a pit in your stomach. Because you look at their teeth, and it's not perio. There's no pockets. They look normal from the front, when they talk, everything. They just have no root left. And to be honest, I have most of my teeth are like that. And to be honest, I have no idea if it was when I was a kid, because I didn't notice it until I went to dental school at 22, and we took our first pano on each other first year, and they're like, you have generalized root resorption. But I've also had a couple rounds of ortho, and I've had trauma, so I didn't know. Like, at this point, my orthodontist is long past dead. He was actually the head of the AAO, so I really hope he knew what he was doing. But that's really sad. Otherwise, Andy ran an ortho residency if he damaged all my teeth. But they haven't fallen out, so I'm okay. I just don't eat apples and bagels. But yeah, there are a lot of medical conditions that can cause this generalized term. So, I mean, obviously, in the past when I've seen it, first thing I do is I'll send them to their own physician. It's a delicate situation. I've called the physician before. I mean, like, I don't necessarily want to write it on a referral because the physician's not going to understand the importance of why you're saying every single tooth in their mouth has short roots. I hope the pediatric dentist noticed it, though. That is really sad if they get to 12 to 14 and they've never had a pano and no one ever noticed it. That's a liability, which is part of the reason why you need to take panos, right? But just did a quick deep dive into the literature. Obviously, I mean, my preference would be to send them to a craniofacial clinic. If you have one, we had one at UCSF. I mean, that's kind of where I like to send kids that have weird things, especially if it's got an ortho component to it, because all the specialists, all the dental specialists and medical specialists are all in one place. They will figure it out. They'll run genetic tests. They'll know what to do. But it can be like Paget's disease, hyperparathyroidism, Gaucher's disease, Turner syndrome. There's a bunch of things that cause this, as well as some tumors, pituitary issues, and other stuff. So definitely, if you see it, try to be calm. You know, it could just be a variation of normal, but if you've noticed a change from an initial one, that's where it's a problem. And again, if they've had trauma or ortho, that complicates things because it might have just been the trauma or the ortho that did it. Hope that helps. Let's try to catch these kiddos and get them taken care of. But no, I would not take them as your ortho patient. Are you insane? Think about this. If we already have short roots, or tapered roots, every patient that has short or tapered roots is already at a risk of having more resorption if you do ortho. So what happens if whatever they have left now is gone and can't chew food, and now they have to get all in 4s at 14? Guess who's getting sued? That would be you for doing ortho. Don't do it, okay? Let the physician and the OMFS clear them first in writing. That way, if something happens, it's not on you. All right, thanks.